Okay, so my topic about artificial intelligence, and I will speak about the enhancing here for the maximizing the potential benefits of the artificial intelligence in maternity services through enhancing maternal and fetal monitoring, improving clinical decision making, personalizing the prenatal and postnatal care, empowering the proficient. And here, this is the digital health and transformation and nursing practice. Actually, they're supporting rapid and positive transformation around all of us for the healthcare system. And according to WHO, they believe that the implemented, if it's implemented correctly, the digital health will be radically change our health outcomes. And this is essential for us to achieving this universally, not only nationally. So the nursing profession will also need to continue reframe this through the carries out clinical practice, education, research, like our professor already earlier mentioned that. Nurses also and coordinators to deliver direct care, steward of the health system. So, according to International Council of Nurses, they calls for individual nurse roles executively for active involvement for organizations everywhere, how to focus on the policy, procedure, and maintains also training, monitoring, and reporting adverse events related to technology. Participation also in professional development to develop skills and competences in digital health, carry out research, using digital health technology. All of this can be in a social implication and have a positive effect in nursing practice. Communicate to appropriate also supervisors and authorities. Any risks or misuse should be observed for that to keep the patient and the people safety throughout the technology. For enhancing maternal and fetal monitoring, there is artificial intelligence can be wearable, and these types can power the monitor of vital signs, fetal movement, also uterine contraction, also can be using for predictive analytics and employ the artificial intelligence to analyze patient data, such as these forms here. This is examples for vital signs, for monitoring the fetal heart monitoring, and non-stress test, also contraction stress test, and also the contraction by these devices. I will speak about it later in details. This video show us how the wearable mobile now advanced to the level that the woman can wear this mobile fetal heart rate device and walk and move from her bed for up to 500 meters.
دكتور حضرتك مش واضح.
I'm just sharing the video. I'm not speaking now.
تمام يا دكتور.
And this video about the mobile fetal heart rate and contraction, and as you see in the video, you can see the pregnant lady can move and she can share it. Also, she can practice the non-pharmacological methods like immersing under warm water, and all of this while she is wearing the fetal heart monitoring or mobile device. Here, the improving of clinical decision making. For sure, we use this also, AI, to enhance our decision making and support the tools that assist our healthcare providers in diagnosing condition. And I have examples here for MRI interpretation. The interpretation here can be used for MRI scan for conditions like endometriosis, or also AI can reach with the gynecologist to make differentiation between benign and malignant masses, which is aiding this in early accurate diagnosis. For obstetrician, the MRI can be using also for frequently distinguish various fetal brain conditions, can evaluate the severity of placenta previa with meticulous and particular involvement in automated extraction. And this part applied in a study for up to 45 pregnant women, and they have a promising outcomes from the study. For preterm birth prediction, can using also AI models can be predict here the preterm birth more accurately via analysis of the biological markers. And these biological markers related to cytokines and the cervical length. And this is, can be imaging techniques also with assistant by ultrasonography and MRI, which both of them can enhance the assessment of maternal and fetal health. Guidance for adherence for algorithm. This algorithm can detect any changes in the biomarkers of the imaging, which give the healthcare providers the signs of preterm labor or complication like cervical insufficiency or the actionable, so that they can take actionable insight for proactive management. How to personalize the prenatal also and postnatal care. The AI have a very good effective here. So it can be applied through multilingual and can be used by different languages. So customize also the care plan for each person. And this is what we are invite our staff to do it, like individualized care, very important. They can individualize the nutrition program, exercise, medication. Also, they can, based on genetic and environmental and lifestyle for each client. This is for personalized. And this is example for the application. It can using a lot of language here. More about personalized prenatal care. You can see here in the picture we have a device. It's called the Plum Life. Here it's applied on the abdomen for the pregnant woman. Can track the contraction frequency, duration, pattern, and the trends. So by this device, it's connected through the phone screen, and the woman by herself, she can detect that, or also the healthcare provider can detect any abnormality of the contraction. This watch here, or what we call the relief band, it be also worn to relieve mild or moderate nausea and vomiting. And this is similar to acupuncture and acupressure when we're using for pain release without any medication, pharmacologic methods, and this can affect the woman to detect also or relieve the nausea and vomiting. So this is can used by this band. For virtual reality, it helps the woman to using for pain management, again, non-pharmacological pain release. So more economical and also very effective for the woman. And instead of asking her to imagine a scene, and the woman maybe in a case not have the ability to imagine anything like that. So we can just give her this device and she can wear it. By the way, I read a research from, I think, Mansoura University. There is a researcher group. They applied this virtual reality on pregnant women. And this is one of the promising research can be conducted in our country. This device. It's one of the integration for innovative technology in practice. It's called the Odin device, and this Odin device made from a very low cost instrument, and it can be have a beneficial effect here with prolonged second stage of labor through the pressure on this hand. If you see here, this hand here, and they will do pressure on the throughout the bag, and this rubber circle will be around the fetal neck, and it can help to deliver the baby's head. Personalized treatment plan also through the treatment. IVF can be have a promising future with the application through identification of the most viable oocyte, so we can select the most viable oocyte and embryos, or enhancing a customization for IVF or protocols that be also individual patient. So now we can tailor the IVF according to the background and the history of our patient. For AI-based question and answers, can used also to provide accurate and reproducible, efficient for staff performance. Now I reach to the empowering for the patient through the education, and this is part of the theme of the conference. Through the application and advancing in this, the woman can use the application to follow up her pregnancy week by week. So can you imagine that? So here the photos, it's colorful, it's not black and white. The woman can see how the babies looks like. I'm sure the woman cannot understand what happened there, but at least she can follow that. And in the same time, the care provider can provide her with full information, and the virtual assistant can give her through chatbots how the maternal related question be answered and supported, so the woman will be feel comfortable throughout the pregnancy from question and answer for anything that she might ask about it. More about integration for innovation technology, pink luminous breast. We know that we invite the women all the time to do self-breast examination at home. And here, this novel lid can be available in the pharmacy. The woman can purchase it and use it for providing a rapid, portable, painless, easy to use to detect breast cancer, and this is can give the woman picture about the tissue of the breast, and give her details about if there is any abnormality, and for sure she will back to her healthcare provider to give her if this is abnormality or no. Telehealth, it's mentioned earlier also with my professors before in their presentations, and my colleagues. Telehealth very important, and as mentioned by Dr. Amal also, it was very beneficial during the COVID-19, even if we used the phones call for virtual consultation. So we need also to apply this technology in our hospitals. For electronic health information, very professional, because I can back to my patient history, background, profile, everything at any time. At the end, artificial intelligence is reshaping maternity and midwifery care by improving clinical decision making, strengthening the maternal fetal monitoring, and expanding access to safe evidence based practice. This is what we invited before, and evidence-based research. This is what also is still invited the people to do it. And now we are invite the people to use evidence-based services through the tools also, such wearable, predictive analytics, advanced imaging, telehealth, personalized digital support, AI transforming both nursing practice and pregnancy experience. As also digital health advances nurses and midwives remain essential in ensuring technology is used safely and ethically, protecting patient dignity, promoting digital literacy, and contributing to education policy and research. Ultimately, AI enhances our ability, no doubt about that, to deliver timely, compassionate, and high quality care, which is supporting outcomes for mothers and newborn and families, which evolving in the digital world that we live now. I reached to the last slide here, my home messages. Artificial intelligence supports, but for sure, not replaces the nurses and midwives. Digital transformation is reshaping maternity care. Nurses must lead safe and ethical AI integration. AI enables personalized and accessible care. Digital literacy is now a core professional competency. Collaboration drives successful implementation, and AI strengthens the heart of the nursing. So this is very important for us. This is my references, and thank you for sharing and to be among all colleagues from all university in Egypt. Thank you very much for this opportunity to be among all of you today. And I hope to be next time with a personal meeting, inshallah.
Thank you, Dr. Huwaida.